So I just want to start for an introduction with something like a good 300 years back. You know this picture if you've been at the National Gallery. And what strikes us is something here in the front. Where's my cursor? This one. Any guesses what's that? It's a skull. Correct. And if you look at it from a side, then you get it right. You have to look at it from a very, very sharp angle. Can you turn it a little bit higher up there, back in the so I can see whom I'm talking to? This is pretty much what I'm going to show you regarding Phineas Gage. If you look, if you squint a little bit and look from the side, then you get it right. Just for a check, who doesn't know about Phineas Gage? He's the poster boy of every textbook, but still not. Is there anyone who hasn't heard of it? Great. I'm going to tell his story in the first place because I ran into surprises when trying to reproduce what other people have thought to have found about him. So this is where it happened. There is a researcher, Macmillan, who's retraced everything that can be retraced about Phineas Gage, and that's where I got this picture from. In Vermont, they have these rocks they have to blow up in order to build a railroad. And the way it works, you drill a hole in the rock, you stick in dynamite. On top of dynamite, you have to pack in sand. The fuse is already in there, light it up, blow it up. And he was a foreman, 35 years old, very talented, and working on this railroad track near Cavendish, Vermont. And somebody else was packing in the dynamite and the sand, and he was coming with the so-called tamkin, a tamping iron, quite big, and packing the whole thing. And at one point, it's not very sure, either he wasn't paying attention or the guy before him didn't pack enough sand. But as he was packing the thing, which probably didn't contain sand, a spark went off, and the dynamite blew up, and it propelled this big thing. It's 110 centimeters long, and 6 kilograms. It's quite a rocket through his left cheek. It went through. Here's another picture just to get an idea of how big it is. It went through his head. It landed a few meters behind him, but within a few minutes he regained consciousness. They put him in an ox cart, took him to his lodging place about 3/4 miles away from the site, and he sat on the porch waiting for the doctor. Finally the doctor came, and these were his words: "Here's enough business for you, doctor." And sure enough it was. He still could see with his left eye for a couple of days, and he only lost his eyesight later. That's very important for what I'm going to tell you. And this is a life. So in a few months he recovered, and that's where the legend starts, because in the documentation we have, there is very little about it. Dr. Harlow was his attending physician, a young doctor in Vermont, and he kept a very accurate record of what happened. He went through a good few days of fever, but that was it. He recorded he said he lost a lot of blood, but as recording his pulse, it wasn't that high. So maybe not that much blood. After that fever, he started recovering. He lost his eyesight. And in a few months, he was quite physically okay. He was a bit weird, a bit childish. He didn't quite get the sense of money, for instance. But then he started walking the earth with his tamping iron. and tried to even make a buck by exposing himself at Barnum's. That was kind of a circus, a freak show in New York. That didn't work out. And then he worked as a stable boy in New Hampshire, and eventually he got a job as the coach driver in Chile, where he worked for a good 6-7 years, driving the coach from to and from Valparaiso with 6 horses. This is quite an involved thing to do. Plus, you have to deal with customers. You try to get along with them. You have to attend to your horses. It's not that clear that he was not functional. He might have been a bit weird, and somewhat he probably was, but clearly he was a socially functional guy. After like 8 years, he returned to the United States. Meanwhile, his family had moved to San Francisco, so that's where he joined them. And his mother records that he was entertaining his nephews and nieces with wild stories about South America, which again is not very strange. However, for the medical folklore, it got that he was completely unreliable, foul-mouthed, and couldn't hold a job. Well, he did hold a difficult job for at least 6 years. Toward the end of his life, when he went back to California, yes, it seems to not have worked out for him. Eventually, he started having seizures. That's probably from the scar tissue in the brain. And then in 1860, he died. This was quite interesting for everyone, and they started trying to figure out what happened and what was damaged right at the very beginning. And the first one to do reconstruction was Professor Bigelow. He was a new professor of surgery at Harvard, and he took what he called an average skull. Now, I don't know what an average skull looks like. I only saw real skulls, and they are all different. Anyhow, he took something that he thought it was average. He drilled 2 holes in it, according to what he saw in the patient, and this is what he got. But Phineas Gage was in 1850, was still alive, so he couldn't really take a better look at it. He saw the templing iron that was still, and it's still available. Then, after he returned to the U.S., he died in 1860, and Dr. Harlow tracked down his relatives back in California, and somehow induced them to exhume him and give him his skull and his stamping iron. And that was the second reconstruction in 1868. He looked at it, and he did this, had somebody, probably he commissioned an artist to do this drawing. Again, it's roughly how he imagined that it must have happened. The inference was that the rod, the stamping iron, came out in the middle of his head. And that's what everybody believed even after that. Now, then in 1994, there was a very well-known research published in the Science magazine by Damasio. They took some measurements on the skull, took another skull, they called it this time a standard skull, and did some probabilistic computations on where the rod might have come out, and they already had the preconceived idea that his Phineas Gage's behavior was very profoundly altered. So for this, we need the damage to the frontal lobes, and to make sure that we sustain our theory, then we have to blow away both frontal lobes. So this is how that's why they have the rod coming out right in the middle. And this is what I believe too. Never really questioned this thing until one day I saw the skull itself and the rod up at the Harvard Museum of Anatomy. Um, and a student was asking me that he wants to do something really cool. He wants to get an honors graduation, and let's do something cool. Well, you can visualize what everybody knows, and we have good tools for that. Let's do for it. Let's go for it. And he got the skull, brought it down. It was at Bodyguards. The skull. It's insured for an unknown amount of money, and it can't leave the building except in the company of 2 custodians. I wasn't allowed ever to touch it. They touched it for me. They turned it when it came to that. So that's how we got it into the CT scanner and did the 0.5 millimeter slice CT of the skull, and then with the tools that we already had used for these kind of things, we did a reconstruction of the skull, as you can see it here, and then we'll see it again. To do a model of the rod, that was very simple. We know it's 106 centimeters, it's 3 centimeters in diameter, and it tapers off to about 6 millimeter at the tip. So that was easy to build. And then we pulled it all into a software, and we intersected the 2 models. So you have the entry hole and the exit hole are pretty straightforward. You just do the transforms and put this model, one model into the other, and this is where we get. That's where the surprise started. So this is how what it looked like in this is the first image, and you see that it's quite tight. Now, if you subtracted the model of the rod from the model of the skull, there's the intersection is colored with pink and purple, and you can see that this is quite a sizable difference. So the rod is much bigger than the hole it left, and there is no so much callus formation. That's a couple of millimeters. You can't have 10-15 millimeters of callus formation. So what happened? And that's when I first started to look and not take it for granted what I received from my predecessors. In the first place, I talked with a colleague who was a practicing neurosurgeon, and he told me that, wait a minute, this thing cannot come out in the middle of the head because you have the superior sagittal sinus, and if you just make a small nick on that, I crap my pants and I immediately have to lay down the patient because he will develop embolism in no time. Now this guy traveled for 3/4 of a mile sitting on in an ox cart. Then he was sitting while waiting for the doctor. No way that the superior sagittal sinus was damaged. That's in the middle, so it can't go out there. And he went back to the drawing board, and again the 2 custodians brought over the skull for us to look at it. And I already noticed this crack here, but as a good arrogant clinician, I immediately explained it away that this must have been some secondary infection. He might have developed osteomyelitis, and there was no antibiotics, so that's why it left it. Actually, it doesn't even faintly look like osteomyelitis. That was my slipshod theory before I knew what the problem was. And what's interesting that Harlow in 68, he also renders very correctly that crack. And here's another one, we'll get back to it. Here I see it. But he doesn't bother to interpret it either. And here it's a close-up, so you can see that this is the hole that where it broke through. And this crack is contiguous goes all the way to the orbit, and this one continues from the bottom of the orbit toward through the maxilla. Here you can see it better. Here, this is how it runs. On the side, on the temporal bone, you can see this fine crack, but it's also contiguous, and you can see that the suture of the temporal bone is kind of loose. From the inside, you can see it even better. Again, from the hole, the entry side of the rod, it goes all the way through the temporal bone. Here's just a close-up of the same thing. But then you can see that it's continuous, and here it healed. It was probably very close, and it healed. Here you have its patent. There's another, that's the exit, the entry site, obviously much smaller than the 3 centimeter tamping iron. And here's one crack. And that's from the bottom. So it was inferred even then that he probably had his mouth open. And as the rod entered, it pushed his mandible on the side. Otherwise, it must have had damaged the coronoid process. It didn't happen. It's quite intact. So that's and then now we go to the calvarium where the exit site is, and again it was inferred that it must have come out around here. Well, it didn't. Probably this is where the tip of the rod hit the skull, and that's why it shattered it, and we have a community fracture, and all those little pieces just rotted away or were cleaned away by Dr. Harlow. But what's important is that you see here the bone is a bit rough. In a close-up you can see that it's rough because probably as it opened, we'll talk about it. So it must have opened like a trap door, like a double door. The internal plate must have stuck with the brain, and that's why the superior sagittal sinus was spared, and only the outer plate hinged open. That's why you have the roughage of the bone here. And this is where actually the first impact occurred, and that's why we don't have bone there. So this is how, again, to just recapitulate, there were the 4 reconstructions. And one was using an average skull, the other one was using the real skull, but actually, probably they didn't want to damage it either to try and stick the thing through it. But it still would have been obvious, if you look carefully, that it's much bigger, not just a little bit, the rod. And then Damasio again did lots of fancy calculations, but on a standard skull, doesn't work that way. And so that's how we came up with the theory that as the tamping iron hit his cheek, actually it cracked the skull like you would crack a watermelon. But you have the soft tissue and the skin which wasn't all the way damaged, and that pulled it immediately together. I'll show you, we did this in an animation to get an idea of how it works. So this is the still image first before we get to the animation. This is the inference was that it opened along that crack that I showed you, and that immediately closed again here. Something like this. Let me just show you. I will stop it in the middle to here. Oops, no, I can't stop it. So there are 2 views. It's a bit more complicated. I need to explain. This is obvious, the skull. This is a view from inside the skull if the camera was sitting on the sella turcica. And then in order to not obscure what happens, I reduce the size of the rod to just the axis of it, so it has no dimension. But it's along the same trajectory that you can see from the outside on the left side of the screen. And again, I don't know how to do the plate again. Here it goes. So this is how it probably works. Now, this has some consequences for neuroanatomy and for everything that we believed about 160 years about him. That if we have to spare that, the fact that the superior sagittal sinus could not possibly have been damaged, that's a hard fact. The other one, which is not as hard but is quite easy to infer, that you can't really open the the lateral ventricle without inducing a serious infection. And we were in 1848, no antibiotics. It's hard to believe that he might have survived it. Also, there wasn't recorded any kind of leakage, because if you open it, then you have some leakage either to the nose, and it must last for weeks, if not months, and nothing like that was recorded. He did run a temperature, so he did have an infection, but it subsided without antibiotics in a couple of weeks, and it left no serious effects. So therefore, if we have these two constraints, this enormous missile passed through his skull without damaging the superior sagittal sinus and without probably damaging the left lateral ventricle, then it must have gone quite frontal, quite anteriorly through only the left frontal lobe, which actually undermines the theory, or undermines his Phineas Gage's claims that he proves were the site of the brain localizations which he was used for so many years. We still don't know any more than we did before. About back then, they said that that was the seat of veneration. Maybe, but nowadays these words are very faint, and so actually we went full circle, and after 150 years, we can say that he is not relevant for cortical localizations. That's what we achieved here. Now, how can we use this? That's a good question. The tractography we can refine further. Now, to what extent is the right frontal lobe taking over the functions of the other, of the contralateral? We don't know. We don't have a good record of his behavior. It's interesting that in the first stage after his recovery, he was acting a little bit weird, and in his dialogues that Dr. Harlow records, he's acts kind of childish. But then the indirect proof about his track record as a coach driver and as a stable boy doesn't seem to substantiate that. Again, how does that correlate with what we know about brain localization? We don't know. But at least what we can say that we have to go by other clinical cases. There are a handful of such damages to the frontal lobe, and Professor Macmillan has cataloged them all. He did quite a wonderful work on that. So that is, in a nutshell, what I was going to show you, and I wanted to finish with Macbeth. So that apparently the great poet had an intuition that this is going to happen. And as somebody else said, Professor Bigelow, when the first time the case was presented, that the most striking aspect of it is its improbability. How did he survive it? How did that enormous missile miss so many vital organs? The internal carotid artery, the optic nerve, the superior sagittal sinus. It's something that we really can't replicate. But that won't take us one step further in the localization of brain function. So that's it. Any questions?